What is up, guys? This is Dr. Nick. If you are having any issues in your squatting, maybe you have pain, discomfort, and you're confused on whether your toes should be pointing out or in today's video, I'm going to teach you a simple test that you can use to help determine whether your toes should be pointing out or in and how it can affect you in your squatting. All right, guys, so maybe you're confused on whether your toes should be pointing out or in. Maybe you have discomfort or pain when you're squatting. Maybe you've even been told that your toes should only be facing forward and never be pointing out. There's many different things that you could hear. Now, every person is individualistic and it is going to be dependent really on a hip anatomy. A simple test that you can use to do this is the Craig's test. Now, this isn't the end-all be-all test, but it's useful to help determine if the foot positioning of pointing in or pointing out is better for you. Okay, so the Craig's test, how do you even do it? So what you're going to be doing is you're going to be lying face down. If you're going to be getting assessed, you could have someone helping you with this, but you'll see me here. The person I have is face down and my thumb is on the outside part of their hip. And what I'm doing is bending the leg of the hip I'm going to be addressing and moving it into internal rotation and external rotation, back and forth. And what I'm trying to feel with my thumb is the part where the bone of the hip pops out on you the most. After you're done with that, you would stop moving in and out so you get a sense of when you're going in and out. And then once you feel like it's popping, that bone, that hip bone is popping out at you the most, that's where you would stop going in and out and you would let go and just have the person hold that position. So at the end of the test, you're looking for the angle of the shin relative to a vertical axis. When the shin is closer to being nice and vertical, that helps give you some information. If it's opened up from a vertical axis, that will also help give you some information. So first, when it's closer to being vertical, the shin is closer to being straight up and down, that will indicate likely hip retroversion, which ultimately means at the end of the day that the toes are going to feel more, or your feet are going to feel more comfortable when they're pointing out in your squat position. Vice versa, if the angle is opened from the shin angle is open from the vertical axis, that will help you determine that it's hip anteversion, meaning the toes will feel more comfortable pointing forward in your squat position. Now, there is normative values with these determining on the angle, but I'm talking about when you're going to the extremes, when it's drastically opened or drastically close to being vertical. So again, this isn't the end-all be-all test, but it could be helpful and useful for you if you have any issues determining if your toe should be facing out or in, and it could also help with some comfort levels as you go down into a squat. If you found this video helpful, be sure to like, subscribe, and ask any questions. I'll get back to you. This is Dr. Nick. See you next time.